the phone started ringing off the hook, and women were jumping off their hormones by the droves. And looking at that study, it just didn't sound right. And you know how it's kind of like something's not right when you see it, but you can't put your finger on it, and it's hard to defend your position that something's not quite right. But for years, I've felt that that study was flawed, but we were told, I also thought, who am I? I'm just a practicing OBGYN in the trenches. These researchers must know better. And so you just tend to believe, and women come in and they're fearful, and they're thinking they're going to get breast cancer from taking hormones, rather than trying to talk them into it or telling them. We just didn't have the research to back up that information was wrong.
So welcome back to the LeaderPass podcast. I'm your host, Jamie Minton, and today we're discussing a topic that really might not seem an obvious fit for me, but due to the incredible women in my life, it's deeply important to me, and that is menopause. I'm delighted to introduce to you Dr. Robin Bone, who's not just an expert, but a guiding light for all women across the globe. She's dedicated her life to supporting women from the miracle of childbirth through the transition of menopause, embracing every stage of life with grace and with wisdom. Dr. Bone's a distinguished obstetrics and gynecology specialist at the renowned Oschner Health system in Metairie in New Orleans, Louisiana. But beyond her clinical work, Dr. Bone is also the visionary founder and fondly known as the Life Cyclist, launching on the LeaderPass platform. She's dedicated to empowering women with knowledge to navigate the intricate cycles of life with strength and with courage. This initiative really does reflect her commitment to holistic women's health and underscores her passion for community support. Today, we're not just talking about menopause, we're really going to understand it, and we're going to discuss its impacts and learn how to manage it with grace and with knowledge. So let's dive right in and welcome Dr. Bone to the show. All right, so Dr. Bone, it's great to have you here today. And why don't we start off by talking about your background, what you do currently. You are a practicing, working, what I would call practitioner, but as a doctor in OBGYN. But talk a little bit about where you are and what you do.
So yes, I finished my residency at LSU New Orleans back in 2000. And for about 16 years, I was in private practice in Metairie, Louisiana, delivering babies in the trenches, taking care of women all the way from adolescence all the way through menopause. But the bulk of my practice when I first got out, I had a lot of young patients. And the beginning of my career was very obstetric heavy, as well as to gynecology and surgery. But I've been really doing it all, taking care of women from adolescence through menopause. The last 8 years I've been employed at Oschner Health. And so for the last 24 years, as my practice grew and the women got older, I'm delivering less babies now, and my practice is really more gynecology heavy.
Gotcha. And so that aging demographic, and I think when we had a conversation, you haven't taken a patient for years and years and years, like a new patient.
Correct.
And so that's a lot of babies that you've delivered probably over the years, in the thousands. But now that they're reaching that age, have you just found yourself more engaged with menopause itself and thinking about what you filmed in your new program? You talked a lot about how you really weren't super equipped, or coming out of med school even now, that's not the case.
Yeah, exactly. So, most of our training in OBGYN residency is really revolving around obstetrics. We learn all kinds of things. Obstetrics, we learn surgery, we're learning how to do a hysterectomy, we're learning how to do a DNC. We're learning all kinds of gynecological things, and there's very little emphasis in most OBGYN residencies on menopause. So I was actually very fortunate in that going through med school and even early in my career, I did have some mentors in our New Orleans OBGYN Society who were very proactive with hormones, and there was some hormone talk. So I feel like I had a little bit more exposure, but in residency programs themselves, there's very little emphasis on menopause because we're just busy trying to be trained to deliver babies and handle all the problems and all the crises and emergencies that come up between deliveries and surgery.
Gotcha. And now you're moving into that area yourself, meaning you're going through it or you're about to go through it. And then that's a motivator also because you need some answers, I think, for your patients, you said.
Oh, exactly. So, the 20-year-olds that I delivered 24 years ago are now 44, and that is the crux of my practice now. And so they are struggling and starting to come in with perimenopausal symptoms. And I, at first, like a lot of physicians, was treating anxiety and depression that might have been related to perimenopause, thinking it was just anxiety and depression, and really not putting the pieces of the puzzle together. And I find medicine is oftentimes fragmented like that. If somebody's having heart palpitations, they go see the cardiologist. If they're having joint pain, they're going to the orthopedist. If they're having weight gain, they might go see the endocrinologist or their primary care. And so it wasn't until I started listening to patients in their 40s and 50s, and selfishly, I myself started going through those things and having some of those symptoms, that I actually thought, wow, some of these obscure perimenopausal symptoms are probably related to perimenopause or due to the fact that our hormones are changing.
Wow. And and I guess that was when we first originally talked about you creating this, in a lot of ways, when you think about Life Cyclist, which is what you're creating, it was driven by also not just the big need for it, the lack of information out there, it's hard to find, but then also your availability. I mean, because you're full-time, man. You're building your practice, or you're still working for Oschner, I should say, full-time. And was it due to, just you're getting all the questions, you need to give them something, or tell us why you have created the Life Cyclist?
So what I found is patients would come in, and honestly, that you only have about 15 minutes to see a patient in an exam room. And what I struggled with is they needed more information than what I was giving them in 15 minutes. So I created Life Cyclist really to fill in the gap and to educate patients, because they didn't know that their symptoms were related to perimenopause or menopause. They didn't know what the next step was, and there's so much fear around hormone replacement, and that could be an hour-long conversation with a patient. And so I knew that they needed just that more education than I could do in a 15-minute visit. So I've been giving patients for the last 6 or 8 years homework assignments. I will send them home. Go read this. Go look at this article. Go to this website. Follow this person. And then finally, I just decided I'm going to put all this together and wrap it in a big bow so that patients can go to one place and educate themselves, so that they learn how to advocate when they go to their doctor's visit. And at least they will have done the homework to know these are the choices, and which fork road do I want, or avenue do I want to pursue.
Is that, and you say advocate for themselves, is that because the doctors may not have the information themselves, or they may not naturally say, here's some answers or some solutions? So you want the person that follows Life Cyclist and learns from this to be that like they're their own education, and they're going.
Yeah. So 20 years ago, I am embarrassed to say that I just was not as educated as I am now. So when patients would come in the door, and they would ask about hormones, for example, the words came out of my mouth. An estrogen is an estrogen, and a progesterone is a progesterone. And if it's bioidentical or compounded, or it's all the same. And I truly believe that, because that's what we were taught and what we were told 20, 25 years ago. But I know better now, and I know more now, and I've done the research, but a lot of times we're busy in our practice as physicians. We are off delivering babies, and we're up all night, and we have 25 patients a day, and we're charting, and we're answering portal messages, and we don't have the time to sit and do the research about what is the latest information. And it wasn't until my patients were demanding it, and until honestly I was going through it, that I wanted to know what the latest information was, and what is the research, and what do the studies actually say.
Yeah, and I appreciate that about you, in that a few years ago, I remember you were talking about going to conferences. You're trying to learn not necessarily even from other physicians all the time, but people who are in the medical space with not, I wouldn't say biohacking space, but the longevity space, but also who understood where the advancements have been made. Maybe they're not in a practice or full time, but you dove right in. I mean, you were hitting those events and conferences, and now you're speaking at them, doing that. And that's largely still the same. You feel like even now, when people are coming out of med schools, you feel like even now they're just still not equipped with that knowledge and that information because it's not being taught? Is that
Yeah, absolutely. So the latest statistic on a survey that came out a couple of years ago is only 20% of OBGYN residencies get any formal training in menopause.
Holy moly. Okay.
And only 7% of the residents that are graduating, getting out into practice, feel comfortable having those conversations and treating patients with menopause.
Wow.
So, and I think all that has to do with the fact that the education on menopause was really put on hold. I mean, we were told, take hormones for the shortest duration at the lowest dose, and after 5 years, you need to get off of them. And that was the message back in 2002. Well, what's not really being advocated and expressed is the latest studies that are coming out. The North American Menopausal Society last year came out and said that is not true. If we give women hormones, especially in the first 10 years, it seems that the benefits outweigh the risks. And beyond those first 10 years, talk to your doctor and make an informed decision based on your own personal risk factors. And guess what? You don't have to get off. You just need to reevaluate year by year. So that is the new message, unlike the old message of 20 years ago. But a lot of us as practicing physicians are still relying on the knowledge that we got when we were educated.
Yeah. And what are when you say first 10 years, first 10 years of starting to experience those symptoms?
Correct. First 10 years of menopause. So menopause is defined by the absence of a period for an entire year. So what the latest recommendations are is if you are in that window of the first 10 years of menopause, there's a lot more benefit than risk to starting on hormones. And those benefits include decreased risk of heart disease, decreased risk of diabetes, decreased risk of Alzheimer's, decreased risk of osteoporosis, decreased risk of colon cancer. So as you can see, and the most important, decreased risk of death from all causes from women who take hormones. So you can see that there is a lot of benefit, and we're very lucky in that our National Menopausal Society actually looked at the data and actually revised their previous statements.
Wow, and that comes from this study or this report back in 2002, you said, 2002, and it was like shocking. In fact, I saw the commercial and it was on a major network show, and it was almost the opposite of what you are teaching and what others like you are trying to get out there, and that it's not as scary as it was once portrayed. Talk about that for a second, because I guarantee you people that are listening to this have probably heard of that, or they're feeling the repercussions of the fear that came from that.
Yeah. So back in 2002, there were about 15 million women on hormone replacement therapy. It's about 40 to 50% of the general population of women at the time, and or especially here in the United States. And at that time, there was a study that was done called the WHI trial. And what that study was looking at was they were trying to prove that there was some health benefit for women who was taking hormones, specifically a decreased risk of cardiovascular disease and osteoporosis. So women who took they were trying to prove that women had a decreased mortality and were healthier on hormones. Well, they stopped the study prematurely in one of the arms, which was the arm of women that had a uterus and that were on a medication called Prempro, which was the most common hormone that was used at that time. And they stopped it early because it appeared at that blip of a moment in time that women had an increased risk of heart attacks, strokes, and breast cancer. The media grabbed that. It was one study, and it went, and we all know what happens in sensationalized media now, but it went viral. And it was on every news media, it was on every TV show, And it was honestly passed along to physicians. So I often say, you know where you were when 9/11 happened. You know where you were when the space shuttle exploded. Well, I know exactly where I was when this came out. And the phone started ringing off the hook, and women were jumping off their hormones by the droves. And looking at that study, it just didn't sound right. And you know how it's kind of like something's not right when you see it, but you can't put your finger on it, and it's hard to defend your position that something's not quite right. But for years, I've felt that that study was flawed, but we were told, I also thought, who am I? I'm just a practicing OBGYN in the trenches. These researchers must know better. And so you just tend to believe, and women come in and they're fearful, and they're thinking they're going to get breast cancer from taking hormones, rather than trying to talk them into it or telling them, we just didn't have the research to back up that information was wrong. So it was easier to say, okay, well then just stop them.
Right, because you didn't have the answer anyway.
Yeah.
Yeah. So when did that change, or when do you feel like that was, I don't know, debunked or?
Yeah, so the last 20 years, there has been subsequent studies.
Okay.
But that's not all over the media. Nobody's talking about it. And researchers, even the WHI researchers, have gone back and really stated that some of it was misinformation.
Really? Okay.
That it was overblown, it was over-exaggerated, and that research was incorrect. So they kind of reevaluated it, and yes, there was one more breast cancer per 1,000 women per year, but it was one, And when you look at the benefit of hormones, 900 out of 1,000 women will have an improved quality of life. So we're going to base our decision-making based on this one extra woman per 1,000. You can see that that's just overinflated and overblown. So women really, over the last 20 years, not only have been suffering with their hot flashes and night sweats, but there's also a whole generation of women who have not had the benefit of taking hormone replacement. So, and as we talked about, that benefit is cardiovascular disease. And what have we seen over the last 20 years? Cardiovascular disease is up, especially in women. Breast cancer is up in women. It's at a rate higher today than it was 20 years ago, yet more women are not taking hormones.
Wow.
In fact, only about 7% of women today actually take hormones.
Okay. That's surprisingly low. I would have thought more by now, but I guess not. So we talk about hormones. I know also Life Cyclist, when you go through solutions for these symptoms, it's not just hormones. There's other solutions that you're saying, hey, there's numerous options. If you're out of that age bracket or stage of life where hormones would make a difference now, is there a pivotal time where you shouldn't try to start that?
I think it's really important to have individualized therapy for a patient. So really, as a physician, sitting down, what are your risks? What are the benefits? What is your medical history? What is your family history? All of that comes together to decide whether or not taking hormones is right for you. There are some people who should not take hormones. For example, if you've had a pulmonary embolus and a blood clot that's gone to your lungs, if you have active breast cancer, there are certain situations. And the cool thing about Life Cyclist is you've got tools for every situation that's built in there. Right. I mean, some women just don't want to take hormones, and that's okay too. But as long as they know the risk and benefits, and then we can provide alternatives, because the whole idea is to make the patient feel better.
So you mentioned there are other things besides just hormone. Give us a few. Like tell us some other avenues for people.
So what you'll see in Life Cyclist is that we really address aging well and feeling your best in midlife. And hormones, quite honestly, are just one spoke on that wheel. And I think of going through midlife with 5 spokes, and they're all equally as important for healthy aging.
Okay.
Hormones is only one. You have sleep, And sleep is critical. It's a time in the day where our body's recharging. So we're recharging our batteries. It's kind of like a cell phone. As the power gets low, it's going to fizzle out. So same with us. We need to recharge our batteries and get sleep at night. So in Life Cyclist, we're going to talk about tips, tricks, why that's critically important. Nutrition. As we're aging, our inflammatory markers go up. It's a natural part of aging. It's the best time to really, hunker down and start eating anti-inflammatory. And we'll talk about, what that means in Life Cyclist. Another thing is exercise. And this is the one thing that I am not good about doing. It is the part that I struggle with the most, as most people do. We just don't have time. We're so busy in our worlds today. But exercise, which especially strength training and flexibility training, are so important in the midlife. So we'll talk about that too. And then the last thing is stress. Stress really does take a toll on our body. Our cortisol levels go up, our inflammatory markers go up. That leads to more adipose tissue, which is our fat in our belly. And then it's a spiral because insulin resistance breeds increased abdominal fat. Increased abdominal fat breeds insulin resistance. So we'll talk a lot about that. But there is also a category of what are non-hormonal options that you can use to feel better too. So if you're suffering with hot flashes or you're suffering with joint pain, things like turmeric might help with joint pain. So there are some supplements, and there's also some prescription medications such as Veoza, which came out last year.
That's new.
It's a new medication that is specific for hot flashes. And many women don't know about that either.
It's hot, I've heard, and obviously I'm a guy asking these questions, but I've learned that menopause affects guys as well. It affects everybody. Not that we go through it, but if we're in proximity or our loved one is, it's a big deal. Is hot flashes, is that one of those biggies that you see probably more than others, or what are your top 2 or 3 things that you see patients come in about?
Hot flashes is a huge one. So about 80% of women will have hot flashes. So that's a huge chunk of women that are coming in symptomatic. The interesting thing about hot flashes is it's transient. So, the 50-year-old woman has hot flashes. The 70-year-old patient, some of them could still have hot flashes, but it typically wanes over time. So there is a period of time that women will suffer from hot flashes, but it usually does get better. But that is probably the main symptom. But I'm just kind of here to tell women you don't have to suffer with hot flashes. You have options, you have hormonal options, you have non-hormonal options. You don't have to stick it out and suffer. Another biggie is weight gain. That is probably the most frustrating thing because women know eventually hot flashes will go away, but the 10 pounds that came on during the 10 years of perimenopause and menopause are not going to go away. And they're really hard to lose. So the conventional things that used to work for us when we were 20 to get that 5 and 10 pounds off are just not working anymore. And then sleep disturbances. Those are probably the 3 biggest ones.
Okay. So Life Cyclist, why are we calling it, why do you call it Life Cyclist? What does that mean? Because we're talking about menopause right now. We're talking about perimenopause, menopause, those symptoms for that stage of life. But Life Cyclist is it feels like it's every stage of life. But why'd you call it that?
That is exactly why. Because menopause is one phase of life. It's one cycle of life. And when I think we talk about cycles all the time in OBGYN. We have a menstrual cycle, we have puberty, adolescence, we have pregnancy. All of these are just ebbs and flows of life. And a lot of information is concentrated around pregnancy and puberty. We're doing a lot of education during that time. We're teaching our young girls what's going to happen when they have their first period. We're talking about pregnancy and educating with books and information that's out there. But there's not a lot of books or information out there on the last cycle of women's lives. And this is a huge chunk of time, and pregnancy is 9 months. Puberty is a few years, but menopause, I mean, that, if you go through menopause at 45 and you live till 90, that's half of your life that you're spending in menopause.
Yep. Yep. So Life Cyclist is about the cycles that you're going to go through, which I love. You've got huge experience with birth and with pregnancy, which I know that's down the road for you to kind of consolidate what you've learned there. But you are continuing, I guess, in Life Cyclist to keep that knowledge coming for yourself, which I love. I love the fact that you're not one of those type of persons that says, hey, I've already studied it, I've been there, I've delivered 5,000 babies, I got all these patients, so I know all the answers. You're still learning. And I think that should bring, in my mind, a lot of comfort to those who follow you and those who learn from you.
My husband always says, Robin, when are you going to stop learning? Like, I love going to conferences. I love reading. You know, you have those people in the world that are lifelong learners. That is me. And I also like teaching. So when I was younger, 3rd, 4th grade, I would line up my dolls in the room and just stand up there and teach. And I think it's just when I learn something really cool or a new thing, I want to go and spread that and have other people learn too.
You want to share it.
I want to share it. Absolutely.
Yeah, that's cool. And
Absolutely.
That's part of, let's talk about the nuts and bolts of what you're going to be doing, because you've been with us filming and capturing foundational, what I would call more core content, your core material for Life Cyclist.
We threw around a lot of different names when we came up with Life Cyclist, but I wanted it to be, I like Life Cyclist also because it kind of creates movement, that we're moving forward into something and not stopping. I want people to know that they can move successfully through menopause into the next generation of time in their life and embrace it, you know, and also that they also need to be a part of it, right? So they need movement in their life. So menopause is going to happen. It's just inevitable. It's going to happen to all of us. But we can embrace it and start making active changes so that we can live the next 45 years healthier and more vibrant and really better than ever.
Love it, love it. Let's talk about when we first started discussing this idea of you as somebody who's very, very busy, very active in your practice, and you kind of just thought, well, maybe I should create a course, or maybe I should write something or do something. What was the early genesis of that? And I remember when you came and said, hey, I tried this via, like, I guess, Zoom calls that you do with a handful of people, or you tried using another platform that would basically be, hey, here's where you can come, you know, put this together, manufacture this. But that didn't quite do it, I think, at the time. And that could be a combination of timing, but also for you to step as somebody who, you're not a known speaker author. It's not like you're out there building a speaking business at all right now. I think you should, I think you can. But when it came to creating Life Cyclist and this training program, it takes focus to do. I know what your schedule is. I know you've got, you know, 2 kids that are extremely busy and they're in and out of college, and your practice is thriving. But how, as a person who has this desire to go, I know I need to do something for my patients, I'm only getting 15 minutes with them. What, I mean, helped you step over that line? Because most people that are busy professionals would never do this. But what inside of you made you do that? Or what was the logic that went behind that? I guess stepping out to create this.
Patients needed it. So back in 2021, I engaged some of my own patients on a Saturday morning Zoom. We did 3 Saturday morning, 2-hour sessions. They needed it. I wasn't able to give them what they needed in 15 minutes. So we set up 3 Saturdays, 1 January 2021, from 9 to 11. We created a Zoom group. I invited patients that wanted more information. They logged on, they were educated. It was kind of cool. I got more out of it, or I got just as much out of it, I think, as they got out of it, because I observed the interaction between between my patients. And their feedback was amazing. And honestly, at the end of those 3 sessions, which was 6 hours, they wanted more. They were like, when's the next one? When's the next one? So that started me to thinking, we need to do more of this. patients need hours of information. They just don't need a small chunk in the doctor's office.
Yep. So your patients were the reasons that you took the step to do this, and you've invested in building this and thinking through how you would explain it, which I think is fantastic. And then having you here with us at LeaderPass and LeaderPass Studios has been great, because I get to see someone who's in real life, still building their business, still building their practice and serving people and helping people, take this and kind of consolidate it into where are the most important pieces for people to learn to begin. And I've enjoyed watching that process and how that's unfolded. Part of what Life Cyclist is going to be the opportunity for people to experience that live session with you, almost like they're watching you teach, maybe once a month initially. And you're talking about doing that for free. You're saying, hey, I'll just do this. I'll go live on LeaderPass and do it for free for like an hour. And but then there's going to be an opportunity to potentially be a part of a group or a small group, or maybe a membership of some sorts that would allow people to go deeper who were serious about going deeper. Talk about the free idea, you doing that.
Yeah, so I've kind of mentioned, as I'm a physician, but I also love to teach and pass on knowledge. And so I just thought we could take some relevant topics, maybe once a month, maybe more often. We'll figure out the time schedule. But if I could just pass that information to patients to where they could go to one place and learn the latest information on different topics, we'll just take an hour. I would like to try to have some live interaction. So I might bring on some guest speakers. I might have some patients asking questions, but we'll have time to tackle a topic and do a live Q&A. And I wanted it to be free and accessible to everyone. So that's really the premise behind the whole thing.
Awesome. I think it's going to be huge. I think it's going to serve a lot of people, and low barrier to entry for people to kind of learn more from you, but learn who you are and fall in love with you like we have. And I think it's very exciting to see that happen. So the last piece of Life Cyclist I want to ask you about is, where do you see, when you think about where people are today and the knowledge you're getting? And I want to reference this too. I remember you telling me the last time we were together that even certain supplements that are very familiar to us. I mean, no, I'm obviously not in medicine. I'm more somebody who's looking at health, advantages or whatever. And there was like your big three that I remember you talking about. Talk about that. And then my follow-up question to that is that being taught now in med school? Is that something that even the doctors you're working with, are they familiar with that enough? Because I remember when I heard it from you, I mentioned it to my mom or my mom and dad, and they're like, well, we've never heard that from our doctor. But tell us what those big 3 or 4 that you've got are pretty consistently what you like to at least suggest to people.
Yeah, so I'm going to tell you the background on that first.
Okay, yeah.
So we get almost zero nutrition training in med school. So in fact, my daughter wants to go to med school, and she's majoring in nutrition with a minor in biology, because I told her, Lauren, you've got to go learn this information. I've had to do it my own self, because about 6 years ago, I started having some back pain. And that's really what started my journey. And so everything was normal when I went to the doctor. So I wasn't accepting that. And that's when I started, like you referred to, started going to conferences to learn on my own what could be the cause of this inflammation and back pain. And I learned a lot of it was nutrition, the lack of certain things in my diet that needed to be replaced. So my big three, this is where my big three supplements have come from, are vitamin D. Most of us are vitamin D deficient, and a lot of doctors don't check for that. And we don't even realize that we're vitamin D deficient, but about 80% of postmenopausal women are vitamin D deficient, and 50% of the population is vitamin D deficient. Omega-3s, which is fish oil. We don't eat enough salmon, and we're not getting in our diet, so I recommend that as a supplement. There are many cardiologists that are actually coming out now. It's been interesting, because I started this little journey 6 years ago, and it's interesting how omega-3s are weaving their way in to medicine, but not all doctors are aware of it, because we didn't learn it 20 years ago. And then the last thing is magnesium. So about 50% of patients are also magnesium deficient. So those are my big three big three supplements. And you'll hear some neurologists know about magnesium because they use that as a treatment for headaches. Some cardiologists are recommending magnesium for heart palpitations. But again, you can see how medicine can be compartmentalized. And quite honestly, I don't know. There are very few people who shouldn't take all three of those.
Wow, that's big. Talk about who you're reading and watching and who you like to kind of follow, just for as we're sitting here talking, because it sounds like you're still researching and learning. Is there any names that pop in to your head that are worth people are worth following that you've kind of follow yourself?
Yeah, oh, absolutely. So as far as health and wellness, I love Peter Attia. He is a physician that is just on the forefront of just health and wellness for men and women. So he's one of my favorites.
Okay.
Mary Claire Haver with Galveston Diet. I've been following her since 2019 when she first kind of launched on to social media world. And part of that was because she preaches anti-inflammatory eating, and the Galveston Diet is a kind of combination of anti-inflammatory plus intermittent fasting. So that's another one. Subsequently, I've been following Corinne Min. She is an OBGYN who also had breast cancer, and she is a huge hormone advocate. I think she has some really interesting cutting edge information, so I follow her also. Avram Blooming, there is a Instagram, Estrogen Matters, and I follow that because it also has a lot of information about hormones that are kind of the latest up-to-date cutting edge things.
Okay, so you mentioned that you traditionally have 15 minutes with your patients. If you were able to talk to your patients, and you probably tell them this, but what would you tell a patient to do or think about to maximize that time with their doctor?
Well, first of all, when you come in for your annual exam, the physician, and that physician's busy. She's got a lot, or she has a lot of boxes to check. You know, they're looking at you, they're checking your blood pressure, they're checking your medical history, they're checking your medications, they're trying to do your breast exam and your pap smear and get all these things done for your annual exam. I would really recommend to make a separate problem-based visit because many women have multiple symptoms in perimenopause and menopause, and it's difficult to tackle all of that when you're trying as a physician to make sure that all the boxes are checked at the annual exam. The annual exam is just that, to make sure that your healthcare is up to date. A problem-focused visit will allow 15 minutes just for that one problem. And so coming in, thinking about, all right, I'm gonna write down my symptoms, I'm gonna know what it is, I'm gonna already have thought about what I've tried, how long it's been going on, so kind of formulate that in your own mind. And then what would you like to do about it? You know, so just having an idea on what would you like to do, and then knowing the latest information and research before you go in. There's a lot of times in that first annual visit, patients will bring up a lot of symptoms of menopause and perimenopause, and I give them homework. I'll tell them, go back, read about this, and let's schedule a separate visit to sit down and tackle that topic.
Awesome, that's great. So take it in their hands to be prepared to walk into that meeting for that doctor visit, but a separate visit.
A separate visit.
Okay. You know, once again, there's lots of what I would call experts. You're an expert in your field, and there's lots of experts who have something to share and knowledge. And one of my passions with LeaderPass is working with people to get that out of their heart and their head and their experiences to where it can help people. And that idea lets them scale their reach more people, but also help folks the way they want to do it. And potentially some are building businesses around that. A lot of people won't necessarily have the courage, or they may not feel like, well, you know, I'm not a public speaker and I'm not this or I'm not that. What's your experience been like? And as far as the, you know, any fears you encountered along the way, and talk about how to get to that point, because you've done it. You've done it. This is about to launch while we're doing this interview. But talk about that for a second.
Well, I will say you have helped me get over a lot of those fears where the camera can be a little intimidating. And so if you've reminded me that I just need to help one person that's out there.
Yep.
And this whole Life Cyclist journey is not about Robin Bone, MD. It's about getting information into the people who need it, which are patients that are out there, women out there, right now, menopausal women who are suffering half of, most of us are affected by menopause. So whether it's a mom, a daughter, or yourself, you've reminded me that, just ignore the cameras, ignore everything, just focus on the person that's out there that needs to hear the message.
Yep, that's right. Well, the way we put it is also when you're looking at it into the camera, is that pretend like you're talking to one person.
Mm-hmm.
And that pretending that you're talking and addressing your patient, because you're seeing people one-on-one.
Mm-hmm.
And so when you connected that dot, I saw that change in you to go, okay, I got it. I know how to do that.
Yep.
The other side is trying to be perfect. And one of the things that was a challenge, even yesterday when we started, was the way your brain works is you see, like you have this great memory and this great ability to see what you've thought through and written down. Talk about that and how that was kind of, you were in your own head, you said at one point.
Oh, yeah. Absolutely.
Yeah.
So, as the cameras are rolling, I'm thinking about, okay, I want to say it in this particular way. I want to make sure that my words are correct. It's on film forever. People are going to dissect all the different things that I'm saying, or misconstrue something, or I might say a wrong word, because that just happens in everyday conversation. But, your team really just put my mind at ease. And once I got out of my head and just started talking like I naturally would in a patient exam room, it was like night and day. And there's no way I could have done that without your leadership and the comfort of the team and the atmosphere in the studio. They were problem solvers. In fact, the camera was bothering me so much that your team came up with solutions really to circumvent so that I wasn't disturbed by the camera when I first got behind it. And but then by the end of the day, the camera was perfectly fine. And that's kudos to your team for recognizing my nerves.
Yeah, and we all have that. We all have it. I mean, I have it when I think about getting started. But once you got going, and you were doing what your heart was behind and what you really wanted to do, and you visualized that, and then we figured a few tweaks here or there out, you were smooth as silk. And that's the other part, is that we've got enough going that even when you make that mistake, behind the scenes, we can edit that out. You don't have to stop and try to do a start and stop the perfect way and come up with the best ways of editing it on the fly like that. We take care of that. And so that's the part that not everybody knows until they see it. Then they're like, oh, it really did sound like it was just one sentence that I did, which is the fun and the power of that kind of movie magic feeling. But overall, this has been just a great pleasure to have you be a part of this. And I can't wait to see Life Cyclist when it comes out. The LeaderPass registration page and the free part and the channel itself is going to be killer. We've almost got it done from just the pre-work we've done. And so now we'll take what you did with us and get it out there so the rest of the world can know who you are, but also really, really learn a lot from your knowledge and experience.
Well, thank you, Jamie. I cannot express how grateful I am to you and the LeaderPass team. Professional, comforting, supportive. There are not enough adjectives to describe your professionalism, and I really appreciate that.
All right. Well, thanks. High five.
High five.
All right.